about aphasia, a clinical overview. A 60-year-old man presents to the emergency room with acute onset of confusion. His wife notes that he suddenly became incoherent in the middle of a conversation. He is able to speak in full sentence, but they are nonsensical. He has a history of diabetes, hypertension, and atrial fibrillation. His medications included aspirin and atorvastatin. On exam, he has poor comprehension and repetition. He additionally has a right hemiparesis. Initial HCT is unremarkable. Aphasia is a symptom of language processing, both production and understanding. A careful language examination can help determine the type and localization of aphasia. A careful exam can differentiate aphasia from dysarthria.
Aphasia-focused examination includes word and sentence comprehension, naming, repetition, spontaneous speech, reading, and writing. In our case, the patient's speech is fluent yet nonsensical, and his comprehension is affected. This is a typical scenario for fluent or Wernicke's aphasia. Paraphasic errors, which consist of substituting words either based on category, semantic, or sound, phonemic, can be present. Neologisms, which are new made-up words, can also be seen. This is localized at a superior temporal gyrus. Given the acute onset and its vascular risk factors such as hypertension and AFib, a stroke should be suspected. Aphasia presents in various forms depending on the brain region affected. Common causes include stroke, traumatic brain injury, tumors, and neurodegenerative conditions such as primary progressive aphasia. Global aphasia, a severe type affecting speech production, comprehension, and repetition, stemming from damage to extensive areas of the language-dominant hemisphere with involvement of Broca's and Wernicke's areas. Broca's aphasia, arising from damage to the language-dominant inferior frontal lobe. It results in laborious and reduced speech output and a limited vocabulary with relatively intact comprehension but impaired repetition and naming. Transcortical motor aphasia, characterized by reduced speech output similar to Broca's aphasia with preserved repetition. Damage to regions anterior or superior to Broca's areas, as well as the supplementary motor area, have been associated with this type. Broca's area is spared. This can also be seen in a recovering Broca's aphasia. Wernicke's aphasia, associated with posterior superior temporal gyrus injury. It leads to fluent but incoherent speech with impaired naming, comprehension, and repetition. Transcortical sensory aphasia. Similar to Wernicke's aphasia, it is categorized by impaired auditory comprehension while maintaining fluent speech with semantic paraphasias. Unlike Wernicke's aphasia, repetition is intact. Typically, it involves lesions in the left temporal lobe near but not directly involving Wernicke's area. Mixed transcortical aphasia. The type is characterized by reduced fluency and comprehension with preserved repetition ability. It is typically caused by damage to the watershed area between the anterior, middle, and posterior cerebral arteries. Conduction aphasia. This type is characterized by difficulty repeating words in sentences, despite relatively preserved fluency and comprehension. It is typically caused by damage to the arcuate fasciculus, a bundle of nerve fibers that connects Broca's and Wernicke's areas. Anomic aphasia. Signified by word-finding difficulties, this type typically stems from lesion in various regions, including the angular gyrus, temporoparieto-occipital junction, and the temporal lobe. In rare cases, it can result from damage to the right hemisphere. Here's a chart outlining the various types of aphasia that can be downloaded in the course resources for further review.
Let's return to our patient. He has an exam consistent with fluid aphasia. He's qualified for TPA within the time window and underwent mechanical thrombectomy after advanced imaging. Post-treatment, there was substantial language improvement, although occasional paraphasic errors occurred during casual speech. For more information on aphasia, including a further understanding of the terms mentioned in this video, please see the course resource. For more information on this and other neurologic conditions, please visit aan.com/neurobytes.